This is Gene Therapy for Hemophilia, Dream or Reality, a show on behalf of the Canadian Hemophilia Society. Here's your host, David Page.
I'm David Page, your host for today's debate. Over the last 40 years, we've witnessed tremendous advances in care and treatment for people with hemophilia. Gene therapy has been a dream for most of those 40 years. However, the question remained, was it just a dream or would it become reality? In the last 6 months, 2 gene therapies for hemophilia B have been approved by Health Canada, and Canadian health technology assessment agencies have recommended both to be added to provincial drug formularies, conditional on price reductions. Gene therapies for hemophilia B are very close to being a reality, but are they for everybody? In this podcast, I will ask 4 people with severe hemophilia B to debate the question: if gene therapy for hemophilia B were available in Canada tomorrow, would you want to receive it? Let's meet our debaters. For the yes side, arguing that they would be interested in receiving gene therapy, Elizabeth Vansant from Seattle, Washington. And let me say that I'm very happy to have a woman as part of our panel. Elizabeth, could you please introduce yourself?
Yeah, hi, David. As you said, my name is Elizabeth Vansant. I'm thrilled to be here to be your token woman on the panel. Yes, I do have severe hemophilia B with no family history. I'm a music therapist and actually got into this from doing my own sort of therapeutic music when I was learning how to self-infuse. So I have hemophilia to thank for my chosen profession.
And for those perhaps less familiar with hemophilia B is the rarer of the hemophilias, and very few women in the world suffer from a severe form, factor 9. So we're really privileged to have Elizabeth on the panel. Also on the yes side, from North Vancouver, British Columbia, Mark Pervan.
Yeah, my name is Mark Pervan. I'm 44, factor 9, less than 1%. As said, I live in North Vancouver, British Columbia, with my wife and 2 sons. I was born in Calgary, moved to Toronto when I was about 7. There I met the hematology team at the Sick Kids Hospital, which included Anne Harrington. And then through Sick Kids, I went to the YMCA with Wanakita summer camp. And my love for the outdoors exploded. She was a great lady. She taught me growing up with hemophilia B wasn't necessarily a death sentence, and that I needed to carry on exploring and just being outside. And she really helped develop a love for the outdoors for me, because I took away the fear, really. She gave me hope that things would get better and I should plan for a longer life. So fast forward to my life now. We moved out to BC about 7 years ago for one main reason: the exposure to the mountains, the incredible backcountry. We rock climb, mountain bike, hike, hunt, fish. We explore the spectacular rainforest every chance we get. It's truly a paradise out here, and I'm grateful I lived long enough to move out here. So.
Well, thanks for mentioning Anne Harrington. She's well known and well beloved by many people growing up in Ontario with hemophilia. And now for the no side, arguing that they would not be interested in receiving gene therapy were it available tomorrow, Murray Milne from Duncan, BC.
Yes, hi there. I'm 66 years old, retired, factor 9 severe. I'm kind of a fence sitter. If this question was thrown at me 10 years ago, I think I would be definitely a yes person. But I'm looking at life in a practical way. I was born before everyone else on this panel, and so I was brainwashed in a different way about how to live with hemophilia, because I had different treatments. And so I've always had a little braking mechanism. And I think I'll just stop at that moment and then we'll discuss.
Okay, well, I look forward to hearing your reticences. And also on the no side, from Montreal, Quebec, MATHIEU Jackson.
Hi, David. Hi, everyone on the panel. Thank you for inviting me here. This is a pleasure. My name is MATHIEU Jackson. I live in Montreal, Quebec. My age, I'm 38 years old. I work at the University of Montreal Hospital Research Center in patient engagement. So we work with, we think about shared decision making and issues like this on a regular basis. And I've also been quite involved in the patient society, the Canadian Hemophilia Society, in the Quebec chapter. I'm looking forward to having a good discussion with you all. And I have hemophilia B, obviously, since I'm born.
Let me say at the outset that the sides and the teams were Somewhat chosen by toss of a coin. I did give a bit of leeway to people who preferred to be on one side or the other, but they didn't really have complete freedom of choice. So they're being asked to argue their side as best they can. So their statements do not necessarily represent how they really feel. And so our goal is to present the pros and cons, the benefits and risks of gene therapy in an entertaining way. So please sit back and enjoy the debate. So to get things going, Elizabeth Vansant, for the yes side, would you want to receive it? You have 2 minutes to tell us why.
Thanks, David. Yeah, I'll get us started today. So when looking at the efficacy for the two products on the market today, it's really promising. Focusing singularly on the product with the higher efficacy, 94% of the 52 responders had elevated factor IX levels within the mild to normal range, and the average bleed rate was reduced by 54% as compared to prophy. While I am very lucky to not experience massive bleeds, I do still experience microbleeds on a normal relevance, and it's much more often than I would like. I also want to point out that I have terrible veins and lasting anxiety and trauma over venous access from when I was younger and learning how to self-infuse. And I do worry about what treatment will look like as I age and my veins worsen and continue to gain that terrible scar tissue. Coming from a female perspective, I am a woman who is still going through monthly menstrual cycles, and being able to choose a birth control product that isn't high in hormones to mitigate my bleeding would be amazing. Even being on prophylaxis, I have heavy and lengthy periods without the use of hormonal birth control. Even forgetting to take the oral contraceptive just 1 day per month causes me to bleed for an excess amount of time. I also have one more pretty neat point. I was actually on a PUP study, or a previously untreated patient study, as an infant for a recombinant factor IX product, and that product was game-changing. My parents were very brave in choosing to put me through that study, and if I could show that same sort of bravery to be a participant at the start of the next new product that changes people's lives, I would be very grateful.
Thanks, Elizabeth. And now Elizabeth's teammate from Team Yes, Mark Pervan. Go, Mark.
Yeah, thank you. I'm definitely on the yes side as of now. As I mentioned, I live a very active life, and I was raised to believe, regardless of my hemophilia, that I should push forward and chase my dreams and desires. You know, my parents, they put us into contact sports and traveled around the country doing so. We were outside at every chance we got. I got into skydiving. I rock climb, like I said. You know, it's quite a life. But why I would lean towards yes is, like, it has been a burden for me and my family, you know, having hemophilia. Granted, the treatments have come a long way, and, you know, a weekly injection right now isn't that bad if I'm in the city, but it definitely becomes a big deal when I leave and explore. For instance, last year, my wife and I took our children to Vietnam for a backpacking trip for a month, and you know, packing the necessary meds and paraphernalia in an already too small backpack was definitely a lesson in space management. You know, I could put it as plainly as possible. It's like I really do hate having hemophilia, and I wouldn't wish it upon anyone. If gene therapy was a reality, even with the possible short-term side effects, I'm in. I think I would do it. You know, short-term pain for a long-term gain. I know I can put up with a year of heavy scrutiny and examinations. I live close to the hospitals and labs. I don't have any problem with that. I'm a superintendent where I work, and, you know, if I have to leave to make time for this, I can do so. I know that I have the mental fortitude right now to push through. I'm not sure I would be able to say that in the future. My veins are still viable right now. I like to keep them that way by reducing, you know, overall long-term injections. So I don't drink alcohol. I don't take painkillers when I'm injured. I don't smoke. My liver is great even after 38 years of curing hepatitis B, which I got because I'm a hemophiliac, by the way. I can't say with certainty what kind of shape I'll be in as I age. So I think right now I'm still leaning on the yes side. I want the freedom to go where I want and recreate the way I choose without the mental and physical burden, you know, that living with severe hemophilia B has provided me. I know that every time I go into the backcountry, my family is worried a little bit more than my friends, the family of my friends. They know how bad my bleeds can get. There's also a negative message that I've always had, you know, growing up with hemophilia. You know, I feel like I'm deficient, or what's wrong with me? Why can't it be normal? You know, my family have seen me treat at the dining room table for years, and, you know, these negative messages always pop up. I think having a treatment like gene therapy definitely give me another hopeful perspective with confidence to venture further untethered.
Thanks, Mark. Very convincing arguments from both people on the yes side, and now to the no side, arguing that they would not be interested in hemophilia gene therapy, even if it were available tomorrow. So from Team No, over to you, Murray Milne.
Okay, I'm the waffle man. As I said, if they invented a time machine before the gene therapy, I would be a yes person, because I think when I was around 40 years old, I thought seriously about living outside of Canada, Italy or Arizona, and I was married at the time. I think I've been married to our health system, and the fact that that kept me from doing some of the things that I wanted to do, because I was feeling privileged to basically to get a free medicine that other people with other conditions would not necessarily receive. And yes, living with hemophilia has not been a walk in the park, because I've had something like 3 knee replacements, ankle fusions, an elbow replacement, and the list could continue. I'm dealing with aging issues. And last year I had a tumor in my knee. So I dealt with cancer, and I almost lost my leg. So there's more things on my plate than just hemophilia. I'm amazed at the technology that's available. And as I say, I wish I was a bit younger, because I would be welcoming it. But right now I'm just trying to get used to my body the way it is, and it is getting older and it nags me slightly. And it's not the hemophilia, because I don't have any bleeds anymore. I have the same concerns about the veins that Elizabeth has. I think I'm just going to have to cross that bridge when I get to it. I wish I was in the same environment that Mark was, because I think I had a sheltered life. I was not exposed to basketball or hockey, because the treatments weren't what they are now. When I was a 15-year-old, I was taking plasma. And so basically, I would get messed up very easily. So like I said, I've just kind of rolled with the punches. And I wouldn't mind being a guinea pig, per se. I have no concerns about the 1 year of testing and giving up alcohol. Those are things that I could accept. I just think the big issue is resources. In other words, I think there are better candidates out there who could benefit from the treatment, because this is not an inexpensive treatment. They would like to get the price down, but I don't see the price going down overnight, and I don't see the treatment showing up overnight. So in a certain way, I'd like to just pass the baton to someone else who could benefit more from the treatment.
That's interesting, Mary. You all have the same condition, but clearly you have different perspectives and different ways of looking at things. And I think that's the point of this debate, is to show that this may not be for everybody, and everybody has their own situation to think about. And we'll move on then to Murray's teammate on the no side, Matthew Jackson.
So I'm actually quite happy that I was asked to argue for the no side. I didn't choose this side. I was designated, because I think, especially listening to the three of you, I think this is really it is my position today. If I was offered gene therapy tomorrow, I think I would probably refuse, because, as mentioned, when I grew up with the promise of gene therapy. I mean, I'm born in '85. I remember seeing my nurse giving me little images of the sheep. I can't remember her name, but there was a famous sheep that was apparently cured from hemophilia, or that had undergone gene therapy, and I can't remember the details right now. Probably you know, David, better than me.
It was Molly, wasn't it?
Yeah, Molly. And I just kept that image of that sheep. I still remember the actual angle of the picture in the news clipping that I had. And so I was a little boy, and my whole life, I was thinking about this sheep. Okay, the sheep is coming. I will be cured. However, what we've seen today so far, for me, is far from a cure. I mean, we're not there at all. The promise, the dream of the sheep, let's say, for me, was a 1 injection and you're done, and you're cured from hemophilia. And maybe one day, but we are not there yet. at all. And on a personal note, I have friends. I have a close friend actually that underwent trial for a gene therapy, and I saw the effects on his body, the transformation. It's not a light treatment. We're talking about a heavy treatment with uncertain results, and with a very high cost to society. So I think I'll leave it there. Maybe we can get more into detail, of course, about the risks, about liver inflammation and cancer, and my peer mentioned aging with hemophilia. We're talking about aging with hemophilia now. Imagine aging with hemophilia with gene therapy. We have no idea what that entails, right? So I'll leave it at that.
Matthew, you've raised a lot of the uncertainties, which are certainly a key part of this discussion. So some very clear concerns from the no side. And now we'll go on to the second part of the debate, which is the rebuttals. And the no side here goes first. So Mary and Matthew, can you give us your reactions to the arguments that you heard from the yes side?
I think I understand both sides. And I think it's extremely personal situation. And I think, for me, I've had to think about things other than hemophilia that kind of sideline me. So I'm envious of a person that can fulfill all their dreams. I basically had to tailor my dreams and live happily with what I have. And I guess I, as I said, was brainwashed because my parents were I think that sounds ridiculous, but they thought that it could be addicted, almost psychologically addicted to prophylactic treatment. I didn't know what prophylactic treatment was until I was 20 or 25 years old. So anyway, I can't really be against somebody who wants to do this if it's being available. I think the people who are choosing the candidates have to choose the best candidate, considering that resources are limited. It shouldn't be a free-for-all.
And Matthew, how do you respond to their arguments about that this is very efficacious treatment? Elizabeth talked about the research results.
Right off the bat, for me, I noticed that both my peers arguing on the opposing side spoke about things they knew. They spoke about certainties. You're talking about basically bleeding rate. You're talking about the effects of hemophilia, which we know we can isolate. We can say this is A causes B. It's a cause and effect relationship. You know that your joints. I know when I have joint pain, I know why. It's because I bled in my joints. And if I'm having this pain, I know it's because I am having a bleed. And then what do? I give myself my treatment. And if I bled, it's because maybe I didn't give myself my prophylaxis. So there's a real sense of control there on my disease. However, this is with replacement therapy. However, with gene therapy, you completely relinquish control. The thing is that there are so many unknowns. Just look at the statistics of, you can go from, a low percentage, but you can also get supranormal percentage of trough level. So, with risk of the opposite, risk of thrombosis and things like that. So also another thing is that I believe, from what I understand, that you don't get two shots at this. So if you try it and it doesn't work, when the next product comes along that might be better, then you're basically done for. So you're a bit of a guinea pig. In that sense, I mentioned a friend that took gene therapy earlier. He did it knowingly as a guinea pig. He said, I'm doing this for my community. So that's a different thing. But however, if me as a patient, Monsieur et Madame tout le monde, like we say in French, the average Joe, if my hematologist suggests for me to take gene therapy tomorrow, I would probably recommend to that person to wait a little bit and perhaps think about it, and even perhaps consider not taking it and waiting for other products that are down the pipeline, such as rebalancing products, which are interesting, which are also out there and should be considered. And then, I'm speaking from a Quebec perspective, but we still don't have extended half-life. So that's already, before we talk about going on the moon, let's maybe start with having something, simple that everyone else has. So I think that there's this question of timeliness, of course, the question of when to take it. Is it the time yet? I don't believe so. And then the cost to society. Is it responsible to take a product which we know with very uncertain results with that cost to society? I think that, David knows me when I do, patient advocacy, I'm always advocating for the moon. I'm always, no. We need the best. That's what you need to aim for as patient advocates. But in this case, I really have to wonder, is this really the moon? Or are we just, really optimistic? And perhaps we should be a little bit more sober in how we think about it.
Thanks, Matthew. Provocative arguments about the uncertainties and the timeliness and the cost. So let's go back to the yes side. Elizabeth Vansant and Mark Pervan. Elizabeth, perhaps first, how do you react to these arguments? They're questioning the efficacy, they're questioning the curative aspect, and they're raising the issue of cost.
Yeah, I think one of the most interesting points that Matthew made was the aspect of relinquishing control. And as of now, we know how to control our hemophilia B, right? We know when we're in pain, use, but what do we do once we've gone through gene therapy and again, you're in pain? What do you do at that point? I think it's very valid, but I also think we don't know if we don't try. And going back to Murray's point about there being better candidates, I think the best candidates are the willing candidates. So whoever is willing to do it for their community, as Matthew's friend said that they were doing it, they're going to be the absolute best candidates. And it doesn't matter what age, because I think we need people of all ages to participate in these early stages so we can see how it does progress and how it affects people in different stages of life. As far as cost goes, I know it's a little different for me here in the US, but I have calculated what my current product, I am on an extended half-life, so it is a little bit more expensive. And looking at that compared to the one-time cost of gene therapy, it would pay for itself in about 5 years. And that's pretty big as opposed to paying out the wazoo for the rest of my life. So yeah, I think the argument for cost, there really isn't one in my perspective.
And over to Mark. What's your perspective?
Well, it does definitely sound like I have a unique perspective here as far as my risk assessment. I did have a very different upbringing than Murray. Like, I wasn't sheltered as much. My uncle was hemophilia factor VIII, and he was about your age, Murray, and he had a lot of complications, and he's dead now a number of years ago from a complication. My brother also had hemophilia B. He's dead now. Most people I met at Wanakita, the hemophiliacs I knew there, a lot of them have passed away. I've known a lot of people that have died, and from complications with this. And I have one friend that contracted HIV/AIDS, and he stayed at the forefront of possible treatments. And he was always willing to go forward and try new treatments. And he's still thriving today because of that. And maybe he's a unique case because of it, but the proof is in the pudding with him for sure. I think my risk-taking ability is sort of pushing me towards wanting to do this. And I have 2 children now. I'm trying to adopt 2 more girls from Ontario, my grandnieces, and I'm expanding my family a little bit here. And part of the problems I've had with hemophilia is getting life insurance. And I'm wondering about the possibility of gene therapy helping that case. In the eyes of the underwriters, if I have this and it's a successful treatment, is that going to benefit us in the long term? So I think that would definitely be a pro in my case. And honestly, I did grow up thinking I wasn't going to live very long. So that whole aging with hemophilia thing is so far down the road for me, and I'll just deal with it when I get there kind of mentality. I'm more likely going to get eaten by a grizzly bear or fall off a cliff than die with hemophilia complications. So that's a reality for me, because if you spend enough time in the woods and doing the things that I do, the odds are not in my favor. So
Great, Mark. And the insurance argument's an interesting one. That is a real issue for people. This could make a difference. You're right. Now the conclusions. So I will ask each of you to present in, let's say, a minute or less, the most important arguments in your mind in favor or not in favor of gene therapy for hemophilia B. So in random order, we're starting with Matthew Jackson.
I believe that it comes down to a problem that we often have regarding also rare diseases, is that basically there's a lack of data because those populations are so small. as David mentioned, we have with us today one of the only women with hemophilia B severe out there. So, of course, it comes down to a choice of, like I mentioned, you are being a little bit of a guinea pig in a way. And for those familiar with the evidence-based medicine philosophy or approach in healthcare, it has three main elements. It has the evidence that you find in the literature, the doctor's expertise, the doctor's practical knowledge from his practice, and the patient's perspective, the patient's input. And so I think that what this conversation brings us to really take note of is the importance of that patient input, in the sense that you are assuming the risk. And there is a bit of a question that you must ask yourself is this worth the risk? And according to me, especially the health complications and the uncertainty of the results, for me, it's not yet worth the risk. I would not risk it at this point.
Thanks, Matthew. Next is Mark Pervan.
Where's your sense of adventure? I don't know. It's a tricky one. There's really valid points to both sides here. And, I say it 100% going in, I would do it, yes, here on the podcast. But I think when faced with it, I'd have to really examine it and just, have a full conversation with all my friends and family and hematology team, and just be very, very clear about the side effects and such. So, but for the purpose here, with me and my lifestyle, I definitely want to believe that this is a viable option, and even with the possibilities of the side effects, they'll be treatable for the most part, right? And being able to help the community, I think as well, is really important. That there are people that are willing to do these therapies, that can push through and have the mental fortitude to do it, regardless of the possible outcomes. And just being a part of this cog and just kind of giving back to it, because I know other ways that I can give back, but I haven't been giving back to the community, and this could possibly be a way that I do. So, giving some hope and perspective to other people and other children coming up as well, that their lives don't have to be curbed, and they can chase their dreams and do the things that they want to do, and there are options out there. So,
thanks, Mark, and over to Murray Milne.
When I went to university, I was intrigued with market research. And so I always volunteered for almost any study. And when I first heard about the gene therapy, it was in BC. In fact, even a neighbor sent me an article recently about it. And my gut is basically saying, yes, it's my body and my experience that I've had in the last 2 years. When I basically have survived so many attacks that hemophilia has thrown at me. Like, I've survived the AIDS scare, and I survived the Hep C situation and all those operations. I basically feel blessed somehow that I'm still breathing, because I remember my mother saying, "You're not supposed to live past 30." I don't know why she didn't keep that information to herself. But all I'm saying is that as I feel today, it's not the right time. And I actually appreciate what Elizabeth said. I really think it has to do with the inner will. I think if you are the willing patient, and if you're a believer all the way, I'd say yes. And I think at this moment, I'm not. I want to keep my cognitive abilities alive, and I want to get back on my feet. I'm still actually recovering from that operation last year. And so I just want to function in a rudimentary way. And I'm getting by with my weekly prophylactic treatment. That's it.
And last word to Elizabeth Vansant.
I think one thing we can all agree on is the fact that this is the next step for our community. And because of that, I think it can lead to an easy yes by exploring this next step and seeing what's going to happen and how we can help improve for future generations of hemophiliacs. If people had been scared to try recombinant factors 30 years ago, where would we be today? Would we still be in the middle of an AIDS scare? Would we still be worried about bad blood and having to go through frequent blood transfusions? But instead, people were brave and they stepped up and they were like, yeah, let's try the next new thing. And that's what gene therapy is for hemophilia B. It is the next new thing, and we need to go for it. We need to try it. And I think overall, even if our factor levels are increased by even 5%, at that point, we're covered from bleeds. So even that little bit of an increase would be huge, would be a life changer.
Thank you to our four guests for entertaining and really stimulating debate. You've raised lots of issues I'm sure I haven't thought of, and many of the listeners probably haven't thought of. So we hope it's succeeded in laying out the benefits and risks of gene therapy for hemophilia B. And to learn more about gene therapy, we invite you to visit the CHS Gene Therapy Education Program at www.hemophilia.ca and listen to the whole series of podcasts. Above all, it is important to talk to your primary medical provider or hematologist to better understand if gene therapy is the best option for you.
For more information, we invite you to check out more episodes in this series, Hemophilia Gene Therapy, Dream or Reality. This podcast series was made possible by an unrestricted educational grant from Pfizer Canada to the Canadian Hemophilia Society.